Mabuhay at magandang araw po sa inyong lahat. Ako po si Dr. Bong Bonaventura. Maraming salamat sa PTA, lalo na kay Dr. Nikita Cardenas-Tan for the invitation to be part of this year's Midyear Convention. I'm very honored to be one of your speakers today on this very important topic, the process of bereavement during the pandemic, which I have entitled A Time to Grieve, addressing bereavement challenges during the COVID-19 pandemic focused on the elderly. These are my disclosures. And my objective for this lecture will focus on the unique challenges of addressing grief caused by the loss of a loved one through death during the COVID-19 pandemic, whether through COVID or not. This pandemic has posed unprecedented challenges with the grieving process, setting the stage for more complex and prolonged reactions on the part of those who have lost loved ones. Let me start off with the case vignette. Mrs. De La Fuente is a 70-year-old retired healthcare worker. At the start of the COVID-19 pandemic, she was living in a small farm east of Manila with her 75-year-old husband. One early morning in December 2020, her husband, who had a history of diabetes and cardiovascular problems, complained of chest pain. She sought help from her neighbors to bring her husband to the hospital, but a few hours later, he passed away. She and her daughters held the wake for her husband, and she seemed fine. However, about a week after the wake, she developed sleeplessness, palpitation, poor appetite, and decreased energy. A physician she was seeing for another condition prescribed her a low-dose hypnotic, which helped her sleep, but the effect was short-lived. Because of the persistence of her problems, her doctor referred her to me for evaluation. Upon consult, the patient's profound grief was very apparent. In addition, she had a strong sense of guilt, blaming herself for her husband's death, claiming she should have brought him to the hospital earlier. She also manifested anger towards the hospital because it took a while before her husband was attended to, and the staff was more focused on ruling out the COVID infection rather than dealing with his heart problem. Grief is a normal part of life. All human beings will experience loss of a loved one at some point, and will experience grief. The COVID-19 pandemic disrupted our daily lives and routines in a matter of a few short months, starting early last year, generating uncertainty and anxiety. For the majority of the population, coping at this time has been extremely stressful as we adjust to staying home and distancing ourselves from others, including our loved ones. It is especially challenging if someone you love has died during the pandemic, whether or not their death was a result of COVID-19. Coping with loss is difficult, but in the COVID era, it is even harder. Often the loss of life to the coronavirus is sudden, and family members are unable to be by their loved one's side because of restrictions designed to stop the spread of infection. The separation only adds to the grief and sadness of loved ones left behind. The COVID-19 pandemic is forcing many of us to change the way we go about our daily lives. With those changes, some of us are experiencing a wave of losses, economic, social, physical, and emotional. For some, these losses may build up and lead to feelings of grief. Why is it important to access and allow these feelings? Only by acknowledging the grief we are going through can we take steps to heal. As of the second week of July 2021, the coronavirus had claimed the lives of over 4 million individuals all over the world, with almost 26,000 deaths in the Philippines. It was estimated last year in the US that for every individual who died from COVID, 9 people became bereaved. In the Philippines, because of the extended nature of our families and friendships, there would certainly be much more than that. Several studies have shown unequivocally that the severity of grief before and during the pandemic has markedly changed. A cross-sectional survey done by ASMA and Kaminga has shown higher grief levels are experienced after COVID-19 related bereavement than natural bereavement, and that experiencing a recent loss during the pandemic elicited more severe acute grief reactions than before the pandemic, suggesting that dealing with loss may be more difficult during this ongoing health crisis. In addition, another survey by Breen et al. Has shown that people bereaved because of COVID-19 are at risk of functional impairment, especially if they have symptoms of separation distress, dysfunctional grief, and/or post-traumatic stress. Attention to identifying and treating functional impairment may be important in facilitating grieving persons' full participation in social and economic life during and after the pandemic. The changed circumstances and defining features relating to COVID-19 deaths include the circumstances of the final illness, namely isolation of the terminally ill person, frequently without the presence of loved ones, the personalization of protective clothing and communication through masks or visors and the wearing of gowns, observation often from a distance, rapid occurrence of death, frequently sudden and or unexpected, and removal of the body, also in isolation, and remote identification of the body. In addition, funerals, burials are likely to be sharply curtailed, postponed, or held remotely and with very few persons present. There's sometimes little chance to say farewell in accustomed ways or to observe cultural or religious mourning practices, and there may be regrets or anger about possible preventability of the death, as we have seen in the patient that we mentioned earlier. A persisting difficulty has been noted. Social isolation has brought with it lack of physical support from family and friends, or physically present spiritual support, reflecting sometimes severe societal disruptions in general. Such distancing can intensify feelings of loneliness that is part of any bereavement experience, even without isolation orders in place. Added to this are a variety of changes in living conditions. During lockdowns, if there's a need for quarantine or due to economic hardship. Not least for some, the measures impose a sense of a lack of autonomy, a feeling of freedom lost and gone, which is hard to bear. The feeling of social injustice can prevail as well, for example, due to lack of equality of care across socioeconomic status groups. For those who have lost a loved one during the pandemic, it may be harder to grieve. Some people feel they have been deprived of the ability to really grieve. You might feel like you're in a state of limbo, as though the loss didn't really happen. People aren't always aware that grief is what they're experiencing, which is why it is important not to avoid it or suppress one's feelings, or needing to look as if we've got it all together. We need to give ourselves time and space to mourn. One of the particular challenges of loss during the COVID-19 pandemic is that increasing numbers of people in households are being told to self-isolate or socially distance from friends and family. This may mean you find yourself alone during this time, which can increase your feelings of loneliness and abandonment. Or you may be isolating as a family together, which may be supportive at times, but can also make tensions and arguments bigger and more upsetting. How feelings are expressed varies from person to person, but it is very normal for feelings to change suddenly without warning. Some people liken this to being on an emotional roller coaster. Other people describe how their behavior changes too. For example, people who are normally outgoing may start to avoid family and friends. The desire to talk constantly about the loved one may change to not being able to mention their name at all. Some people get comfort being somewhere that they associate with their loved one, while others will avoid such places as they are too painful. Our experience and response to bereavement may be influenced by our culture, faith, community, or belief group. For example, we may believe in life after death and find religious or spiritual ceremonies comforting. Equally, we may have no religious beliefs and may want to mark the death in a very individual way. For example, having a remembrance gathering in a place that was special to the person who has died. The pandemic may mean that it is difficult to do things exactly as we or our loved one might have wished for, and it is important to look at alternative ways of remembering or acknowledging that some wishes will need to wait for a later day. In recent months, people have voiced their concerns that the COVID-19 pandemic is depriving people of the possibility of grieving. Physical distancing requirements mean that funerals are limited and those who have lost loved ones may have to grieve alone. The inability to say goodbye, the loss of social and community networks, living in confinement, and all the other social and economic impacts of the pandemic may exacerbate the grieving process. And the problem we are facing is that deaths from the coronavirus have resulted in an increased risk of prolonged grief and bereavement, post-traumatic stress disorder, and mental health problems among the bereaved. One reason for this is that the loss is ambiguous. When an otherwise healthy enough person leaves home to go to the hospital, declines rapidly, and the loved one doesn't get to see them throughout that whole process, it creates something like ambiguous loss, according to Reverend Matt Rhodes, Director of Religious Ministries at Penn Medicine Princeton Health. He adds, they are physically gone now as they are dead, but it still feels as though they are emotionally present because one has not had a way to observe their loss. This has led to unclear and uncertain experiences that many people are grappling with right now and describe situations when the emotional and physical realities don't align. In addition, self-blame and guilt are coping mechanisms that some people use when processing grief, but typically only make the healing process more challenging, as we have seen in the case vignette. Three sets of risk factors to produce prolonged grief disorder related to death during COVID-19 are the following. The first one reflects on the circumstances of the death: sudden, unexpected, seemingly preventable and random deaths, people dying alone, restrictions on visiting policies of the dying family member. The second set involves the context of the death: physical distancing policies affecting funerals, burial rituals, and support for the grievers, unemployment worries, feelings of unsafety, and financial insecurity. And finally, third set consists of consequences of the death: being alone, fear of contamination, having others to care for, and again, financial worries. Johns et al. Describe other factors that include, but are not limited to, experiencing more than one death in a short period of time, a strong dependency on the one who died, shocking, premature, unexpected death circumstances, death perceived as preventable, witnessing the death and or suffering, and finally, previous mental illness, especially PTSD. It is very evident that the impact of COVID-19 on bereavement has reached global proportions, as shown here by studies from Italy, India, and Iran by Masiero et al., Rao et al., and Mortazavi et al. As you know, Dr. Kubler-Ross was a Swiss psychiatrist who pioneered near-death experiences and who, as part of her psychiatry residency training in the US, crystallized her efforts in this best-selling book in which she listed the stages of death and dying we are all familiar with. But wait, there's a sixth stage of grief. There has been an assumed finality about the fifth stage of acceptance that Dr. Kubler-Ross never intended. Unfortunately, she died before completing what she was working on with her colleague, Dr. David Kessler. Over the years, they came to realize that there's a crucial sixth stage to the healing process, which is meaning. This isn't some arbitrary or mandatory step, but one that many people intuitively know to take and others will find helpful. In this sixth stage, they acknowledge that although for most people grief will lessen in intensity over time, it will never end. But if people allow themselves to move fully into this crucial and profound sixth stage, which is meaning, it will allow them to transform grief into something else, something rich and fulfilling. Through meaning, people can find more than pain. When a loved one dies, we want more than the hard fact of that loss. We want to find meaning. Loss can wound and paralyze. It can hang over us for years, but finding meaning in loss empowers us to find a path forward. Meaning helps us make sense of grief. It is from this perspective that we look at ways by which we can help the bereaved individual at this time. Many psychotherapies are currently offered via telemedicine as a result of concerns about COVID-19 contagion. Can bereaved individuals benefit from them as well? Therapists started conducting complicated grief therapy, or CGT, via video several years before the advent of COVID-19. While there is a dimension missing when we are unable to sit in person with a bereaved client, clients or patients can still benefit, and many actually prefer the convenience of not having to leave their homes. Although some older adults may find it difficult to navigate digital platforms, over time they can become more comfortable and proficient using these platforms. So how can we address those issues with our patients? The single most important thing that anyone, whether a clinician or a lay person, can do when trying to help someone who is grieving and struggling with the loss of a loved one is to be a good listener. Paradoxically, this involves curbing the strong impetus we all feel to help a person in pain to feel better, rather than trying to reassure or actively comfort them. It is usually more helpful to simply be present with them in their grief. When inquiring further into the patient's experiences and feelings, it is preferable to ask warm, inviting, open-ended questions rather than offer solutions. It is also important to allow clients or patients to accept and come to understand their grief. One way to do this is to name painful emotions such as sadness or anger and observe and reflect on them. Although feelings might be mitigated by mindfulness techniques or other emotion regulation strategies, if they are part of the clinician's toolkit, it is important to remember that painful emotions are a natural part of grief and not a mental health problem. It is helpful to invite the patient to talk about their story, about their loved one's death, the story of their loved one's death, allowing them to voice any concerns regarding the illness or treatment. Some clinicians shy away from this out of concern that it might be too emotionally activating for the patient, but the ability to share the story with an interested person in an environment that feels safe can be part of the healing process. Encouraging people to plan that they will eventually return to the world and deal with reminders of the deceased loved one, even if this triggers grief, can be helpful as well. A commitment to permanently avoid reminders of a loved one can create unneeded restrictions and deprive a bereaved person of positive memories associated with these reminders. But for patients with prolonged grief disorder, the suggested approach is primarily complicated grief therapy, or CGT, which involves these various steps: daily grief monitoring, psychoeducation, aspirational goals work, inviting a friend or family member to a session, imaginal revisiting, including telling the story of learning of the death, situational revisiting, which involves graded exposure to reminders of the loss, and finally, imaginal conversation with the deceased. These are the 7 core themes of CGT, or the healing milestones. The essence is to help the patient move forward, not just move on. So this will include understand and accept grief, manage grief-related emotions, envision a promising future, strengthen relationships, narrate the story of the death, live with reminders, connect with memories. Another important question that comes to mind is whether pharmacotherapy is helpful for patients with prolonged grief disorder. Pharmacotherapy can be helpful for depression and anxiety, which can coexist with grief. However, there is no evidence that antidepressants have efficacy in management of PGD per se. Sedative hypnotic medications should be used judiciously as a rule, and if they are prescribed, they should be used carefully and only for short periods of time. Finally, sleep disturbances can also be approached by offering advice regarding healthy sleep practices and other non-pharmacological approaches. In Kerala, India, they developed the Bereavement Companionship Program, which envisaged having at least one person trained in the program among the first responders in case of a death. The idea is for communities and neighborhoods to build capacity to support members in grief and strengthen the current informal bereavement support that they had in Kerala. It is supported by private groups in India and Australia and the WHO. But with the onset of COVID, the social support system disappeared. Thus, there was a need to have people in the community who were trained and who can extend support to those in grief. The program was launched just last June, and the training for the first batch was completed recently. More than 200 individuals have applied for the program, and they can join. Anyone who's above the age of 21 could join the course and undergo a 15-hour online training. The training is given by experts from the Death Literacy Institute of Australia. And they found this so far something that could be very helpful considering the number of deaths that they are experiencing in India as a result of COVID-19. Let us go back to our healthcare worker. After a few consultations, the patient eventually felt better compared to her previous checkups. She felt less depressed over time. This followed a conversation, particularly a conversation she had with an acquaintance who was at the hospital about the same time her husband was ill. This acquaintance told her that at the time, the hospital was understaffed and was seriously battling COVID-19, with closures of several labs in other areas, so that even if the patient was able to bring her husband there earlier, he would not have been attended to as well. This lessened the patient's guilt and made her feel better, able to accept his death with less self-blame. However, she still wakes up feeling sluggish in the morning. Later on, at the subsequent consult, and in a somewhat weird twist, Noynoy Aquino's death had a positive impact on her. Hearing in the news details about his death, she realized that her husband was in a similar situation as Noynoy, and that despite Noynoy's social advantages, death did not spare him. She became convinced that she had done all that she could to take care of her husband, and her guilt over his death slowly, gradually faded away. People in COVID-19 bereavement situations have to face different or additional stressors and sometimes have to cope with them in novel ways. The landscape of grief and grieving has changed in significant ways from pre-COVID-19 times. Therapists may feel discouraged about how to help bereaved people heal and find new purpose in the future. They sometimes feel that this is not possible, especially for an older person who has lost a life partner or even a child. It is important for clinicians to understand that while grief is permanent, pervasive, impairing grief is not, even in older people or after an especially difficult loss. It's important to be sure that clinicians can recognize PGD and to learn effective ways to address this debilitating condition. It's not as hard as it seems. It's also important to recognize that there is no formula for COVID-19 grief. While it is very helpful to focus on healing milestones and possible derailers, clinicians need to focus on individual patient and personalize their intervention. The famous Serenity Prayer can be another useful guide for clinicians. We can use it to help patients focus on figuring out what else they can or cannot change. We can encourage bereaved patients to move toward accepting what they cannot change and to plan and execute effective action to deal with things that they can change. And therefore, I end with this prayer. God grant me the serenity to accept the things I cannot change, courage to change the things I can, and wisdom to know the difference. That I'd like to end my lecture and to thank you for your kind attention. Maraming salamat.